New CDC data raising concerns about HIV. Infection rates are on the rise among Hispanic and Latino populations.
And experts say the stigma surrounding the virus may be contributing to it. Channel 5's Taylor Winkle with a look at the numbers. It's tonight's special report.
The CDC estimates overall HIV rates in the United States have actually gone down by 6%, but in the Latino population, they're up by at least 14. This is alarming medical professionals in communities like the Rio Grande Valley, where the majority of residents are Latino. CDC data shows 4 states and Puerto Rico accounted for 2/3 of new HIV diagnoses among Latinos, Texas being one of them.
What these rates mean for the state of Texas is that the entire state, male, females, children yet to be born, are at risk for HIV.
The CDC says the need to expand HIV prevention and treatment in the Latino community is urgent.
Latinos are the only group in the United States that actually saw an increase in HIV cases.
Oscar Lopez is one of a handful of Latino leaders regularly meeting with the CDC, advocating for more Latino healthcare resources in the Rio Grande Valley and nationwide.
Regions like San Antonio, Dallas, and Houston have always had the higher rates, but right behind those 4 giant cities is the Rio Grande Valley.
A lot of people think it just falls under gay people, but it's not only gay people.
HIV transmission is tied to high-risk behaviors that aren't exclusive to any one sexual orientation. Anyone who injects drugs or has sex is susceptible to the virus. Leo Benavides found out he had HIV when he was just 17.
I know the pain that falls behind getting diagnosed and the questions after questions, and you don't know who to ask or you don't know how to ask.
At the time, he knew nothing about the virus. Luckily, his pediatrician caught it. Today, because Leo takes his daily medication, the virus is undetectable in his body. That means his HIV viral load is so low, there's effectively no risk of passing it to someone else. The CDC says more than 50% of all Latinos in the U.S. have never been tested for HIV. 50% of Latinos report never having been offered an HIV test. As a result, Latinos who have HIV most likely need to get tested so they're aware.
It wasn't until I started coming in for the regular checkups and everything that it finally sunk in.
For those who do become positive, they tell us it's not navigating the virus that's difficult.
It's the baggage that comes with it, yeah. Because the virus things that I never felt any different, health-wise, anything. It was just all something that was on paper that told me that I had this.
We're hiding this patient's identity because their family doesn't know they're HIV positive.
Why should I lose my family over a dumb mistake? If I had known more about it, I probably would have made better choices. Probably would have asked more questions for the person.
The CDC identified HIV stigma as such a roadblock to life-saving care. They rolled out a campaign to fight it called Stop HIV Stigma. But in South Texas, health experts are identifying another factor contributing to the spread.
Almost every single person who comes in to get tested has met their partners through a dating app.
No one meets people out in the real world anymore.
That's thanks to dating apps, where you can narrow the pool to fit your age range, location, and sexual preference.
It's literally at your fingertips and gives you GPS on how close they are, how far they are.
Some people are very just straight to the point, straight to sex.
Not everyone you meet online is honest.
Are you going to be talking about HIV? Are you going to be talking about any other STDs? Yes, you might ask someone, are you clean? And of course they're going to tell you yes. Of course they're going to tell you what you want to hear.
You forget that people lie, or you see that so you don't think, well, I don't need to ask any more questions because there it is, typed out. They clicked a button, so that must mean it's true.
App users putting on a front that they're protecting themselves from contracting the virus and spreading it when that's not reality.
Before I was diagnosed and I was Grande and all that, it was never something that I ever saw posted. It was never something that I asked about. And now I do.
The vast majority of people who are coming back positive right now are young. They're either between the ages of 17 and 22 or 23 and 28.
Right now in the RGV, we only have a handful of places that offer free testing, but Lopez says not everyone feels comfortable asking for them because of the stigma, the prejudice, and homophobia.
Because sex education went out the window, because parents are still not having this conversation with their children, because the stigma of this disease is still so strong in the Valley, because of culture and homophobia and other things, that people living with the disease won't tell anyone that they have it, including their families. All of that has to change for us to get control of this disease and to make sure that the next generation doesn't get exposed to it.
Conversations that hopefully bring us closer to breaking that stigma that even the most comfortable patients struggle with.
Lopez recommends everyone between the ages of 13 and 64 who've ever been sexually active or shared needles should get tested. Information on where to find a testing location near you can be located through the CDC. You can also reach out to the Valley AIDS Council. All of this information will be available on our website, krgv.com, after the newscast. Reporting in the studio, Taylor Winkle, Channel 5 News at 10.